My name is Manju Agarwal. I work for Artemis Hospitals, Gurgaon. I'm going to talk about early chronic kidney disease, its acceptance or denial by the patients. This is on behalf of Kidney Warrior Foundation that I'm doing this. Before I even begin, I would like to draw your attention to the frequency of chronic kidney disease. As many as 1 in every 7th patient or every 7th human being has chronic kidney disease. And to top it all, 90% of them do not know about it. So that's really disheartening. So to go about this, my outline is going to be how early kidney disease is diagnosed, and then I would give two contrasting case histories, one of acceptance, one of denial. And I'll also elaborate on how treatment can really slow down reaching the end point. And then lastly, I'll give common reasons for acceptance/denial. So how is early chronic kidney disease diagnosed? At the outset, again, I would say in capital letters, usually there are no symptoms. So it goes undiagnosed, unknown, nobody knows about it. But there may be some subtle symptoms like swelling of feet, a little high blood pressure, and very often than not, it may be discovered on tests done for an unrelated reason. Like you go for an ultrasound for, let's say, abdominal pain, and they find something is wrong with the kidney. At times, they can find protein in urine. So it's usually found on a routine health checkup. So routine health checkups should be an important part of life. Or we screen a person who is actually a high-risk person, and it's done with an intent of looking for kidney disease. And this group fall patients who have diabetes, who are hypertensive, or they have family history of kidney disease. Or in fact, anybody older than 60 years also falls in this group. So I'll begin with case 1. Mr. Abe was first seen when he was 40 years old. He came with a high blood pressure of 170 over 100 and was on irregular treatment. He really didn't care about it. His routine blood tests had revealed a creatinine of 1.7, which translates to an eGFR of about 50 ml per minute. And this is a figure given with all creatinine reports these days. His urine routine revealed 1+ protein. His ultrasound shows scarred kidneys. So with that background, he had come to me, and I had put him on regular treatment. And 15 years down the road, he's now 55 years. He takes regular medication, maintains a great healthy lifestyle. His blood pressure is plumb normal at 120/80, but with treatment. His creatinine is still stable 15 years down the road. He's healthy, has a full-time employment. So this was a typical example of acceptance of treatment and acceptance of disease. So let's look at this graph, which gives us how kidney disease progresses. So let's say this is 100% kidney function here on the vertical axis. On the horizontal is age as it increases, or let's call it time frame. It's the same thing in years. So this man was 100 here sometime. At 45 years of age, he had about a 50% kidney function, 50 ml GFR. Thereafter, he was put on treatment and he's stable. And he may remain stable for the rest of his life, if last 15 years are any guide. I often compare it to driving at a fast pace and reaching the destination. So if you drive very fast, you reach the destination. So it kind of, therapy will slow it down. All right. So if you are slow, then you don't reach the endpoint, or here, this is an endpoint, which is an undesired endpoint. All right, so that's how it goes. Let's look at case B now. This was a 24-year-old boy who was seen by me 5 years ago. He had protein in urine at that time. This was discovered on a routine health check for a job, and his blood pressure was 160 over 100. His creatinine was 1, which translates to a GFR of 107 ml per minute. He had no symptoms otherwise. This was all discovered on routine health checkup. I advised him medications to control blood pressure and a kidney biopsy to find the reason for protein in urine. So a lot of us by know kidney disease has stages. So green is stage 1, which is considered minor. And this is the red zone, CKD 5. So 1 to 5, there is deterioration. So this man was in green zone. So he was good to go at that point. But he decides not to take any treatment. He said he had no symptoms and the disease wasn't bothering him. He comes after 3 years with breathing difficulty, swelling on his feet, his blood pressure is still very high. His creatinine had deteriorated to 2.5 this time, and that translates to a GFR of 30 ml per minute. His heart function was reduced. So if we look at a GFR of 35, he falls, he's already in chronic kidney disease stage 3. So he has progressed from green to yellow zone, which is bad. So untreated, it progresses. Another 3 years down the road, his creatinine became 6. Now he has end-stage kidney disease, is looking for dialysis and or transplant. So if we look at the progression in these two cases, case 1 versus case 2. So here was our case 1. Here is our case 2. He was 100 to begin with at age 25. He has deteriorated to end-stage kidney disease in, let's say, about 5 to 6 years. So that's what is a rapid deterioration. So untreated, this is how it goes, or it may be somewhere in between, depending on many other factors like age, gender, genetics, etc., the disease, etc. But treatment does slow it down. So here we have two contrasting patients, case 1 and 2. Case 1 accepted his disease, took medication very, very regularly. He maintained his lifestyle in a good way. He believed in science. He's been stable for 15 years, has delayed dialysis. And as we saw on those curves, he may not need dialysis for a lifetime. Case 2 is in denial mode. So the reasons, if we look at a broad category, why people deny that they have kidney disease, it's, I think, most of all, lack of awareness. We try to educate them, this would progress, but lack of awareness, lack of symptoms. A lot of patients have feelings of denial and fear. They have heard somebody in the family or somebody in their close quarters who has been on dialysis and stuff like that. Some people use religion as a coping mechanism. Some people have come and told me that they chant and that's a Buddhism way of dealing with it. Everything will get all right. Some people think they're too young to take medication. And falling for alternate claims is very, very common in this country. I think illiteracy, no control on false claims puts them, they fall for alternate therapy claims. There are a lot of videos doing the rounds. Some people think medicine may be habit forming. And lastly, I feel maybe a lack of faith in healthcare. So these could be possible reasons why people deny. And I wish more and more people will move to the acceptance mode rather than the denial mode so that kidney disease can be prevented. Lastly, I would like to draw quick attention to this grid diagram. So what people see is actually stage 5 and get disheartened by it. But under that, as an iceberg goes, lies the bigger chunk, which is stages 1, 2, 3, 4. And these can be delayed, prevented. So reaching here needs to be prevented. And that's what will reduce our misery in life. And even below the iceberg lies population at risk. So these are patients who are the triangle that you see. So these are patients who are diabetic, hypertensive, or older age group, and routine screening will go a long way in preventing reaching to stage 5. So, and I would skip this. And lastly, so when we say we save the kidneys, we also save the heart, and we save many other things. So here is the kidneys hugging the heart, or the heart hugging the kidneys. So I'll just read it out for you. People with kidney disease are at greater risk of cardiovascular disease and death at all stages of kidney disease. Kidney disease and heart are so linked with each other. They have common risk factors like diabetes, hypertension, and each condition will lead to worsening of the other. So heart make the kidneys worsen and the kidneys make the heart worsen. And lastly, my slogan, kidney disease can be prevented, and you would prevent the heart disease also. I think I'll end here and thank you very much.